Hi, I'm Sarah Tinsley, and I'll be discussing strategies for living with myelodysplastic syndrome, specifically how to manage your low blood counts. So let's get started. What are the current treatment options? Well, first there's supportive care, which consists of transfusions of both packed red blood cells and platelets, and there's growth factors like Neupogen or Neulasta, and Aranesp and Procrit. There's Revlimid, also known as lenalidomide, Vidasa, Dacogen, chemotherapy, which consists of cytarabine, clofarabine, and etoposide. Another strategy that's used to treat patients with MDS is a bone marrow transplant. And of course, there are investigational agents available. What are the most common side effects? Well, with all of the current therapies that we use for managing myelodysplastic syndrome, there's myelosuppression, also known as lowering of your blood counts. You can have anemia, neutropenia, and also thrombocytopenia. You can have nausea and vomiting, constipation, and renal and hepatic toxicities. For each different drug, there is a specific side effect associated with it, such as with azacitidine, you can get injection site reactions. And with lenalidomide, we can see rashes, some itching or pruritus, diarrhea, and there is, of course, the safety program for lenalidomide known as Revasist. Another side effect of receiving multiple transfusions of packed red blood cells is iron overload, and there's chelation therapy, which can cause cytopenias and also renal and hepatic toxicities. MDS and low blood counts. So anemia is when you have too few red blood cells to carry your hemoglobin and supply oxygen to the body. This is the most common blood disorder associated with myelodysplastic syndrome. Next, we have neutropenia. And this is when your white blood cell counts, specifically the neutrophils, are low, and this increases the risk of infections. We see commonly skin infections, sinus infections, pulmonary or lung infections, and urinary infections. And the third type of low blood count is thrombocytopenia, or lowering of the platelet count. With this, you can see bruising, prolonged bleeding, and sometimes these bleeding problems can be quite severe. What are the symptoms that you see with anemia? Well, some of these seem common sense, like shortness of breath, especially when you exercise, or feeling tired or weak. You can have palpitations where you feel like your heart's skipping beats, or your heart is beating irregularly. You can also have a rapid heart rate, also known as tachycardia. Oftentimes, people who have anemia look very pale to the people who know them the best. People can also have chest pain, mental confusion or difficulty with concentrating. Headaches are also quite common, and lightheadedness or dizziness, especially when changing from a seated position to standing. These are some things that your healthcare provider may recommend. When you have a low hemoglobin, your doctor or healthcare provider may recommend transfusion with packed red blood cells, and this is considered a form of supportive care. The benefits of receiving a packed red blood cell transfusion are temporary, so as the hemoglobin decreases, you may need to receive additional transfusions intermittently throughout the course of the disease process. The number and frequency of red blood cell transfusions can vary from one person to another depending on their underlying medical condition. Another thing that a healthcare provider may recommend for you is a class of drugs called erythropoietin stimulating agents, also known as ESAs. An example or two examples of this class of drugs is Procrit or Aranesp, which may be helpful to some patients with lower risk myelodysplastic syndrome in maintaining their hemoglobin level in a safe range and avoiding transfusion of packed red blood cells. You can discuss this further with your doctor. If the injections are prescribed, be sure to have your injections on schedule. So these are other things that you can do if you have anemia. Let your doctor know if you're having increased shortness of breath, chest pain, or palpitations. Keep all of your scheduled appointments. And there's a blood transfusion tracker that's very handy in recording and tracking your blood counts. You'll want to know what your blood type is and any antibodies that you may develop as you receive repeated transfusions of packed red blood cells. And you also want to keep track of any symptoms before or after a transfusion or with growth factor administration so that you can report them to your healthcare provider. It's a balancing act, really, between rest and activity when you have anemia, and you want to conserve your energy for the times of the day that you have activities that you really enjoy doing and resting right before those. And you can also ask many of your family and friends to help you with things that require extra energy. Another thing you might want to do is ask your family and friends for help with the things that seem to tire you too much. So what can we do with neutropenia? This is called the absolute neutrophil count. And the neutrophils are the most common type of white blood cells and normally account for 60 to 70% of your total white blood cell count. The severity of neutropenia is estimated based on the absolute neutrophil count, also known as the ANC. The normal white blood cell count is between 3,500 and 10,000 cells per microliter. A normal absolute neutrophil count is between 1,500 and 8,000 cells per microliter. Absolute neutrophil count is calculated using the following formula. ANC is equal to the white blood cells times the percentage of neutrophils. Many labs will tell you what the absolute neutrophil count is without you having to calculate it. You can ask your healthcare provider to help you with finding this. The severity of neutropenia is measured by the results obtained from your peripheral blood, not from the bone marrow biopsy sample. Mild neutropenia is considered an absolute neutrophil count between 1,000 and 1,500. Moderate neutropenia is an absolute neutrophil count between 500 and 1,000. And severe neutropenia is when the absolute neutrophil count is less than 500. These are things your healthcare provider may recommend when you have neutropenia. Sometimes administration of white blood cell growth factors help reduce the severity or duration of the neutropenia. Also, the administration of antibiotics can help prevent infections and may be recommended for some patients who are at greater risk for infection. If your neutropenia is severe, it may be necessary to modify your myelodysplastic syndrome treatment by changing the dose or holding the medication temporarily until the neutrophil count recovers. These are some recommendations for things that you can do if you're neutropenic. Let your doctor know if you develop a fever when your absolute neutrophil count is less than 1,000. If you're not sure what your ANC is, be sure to ask your healthcare team for guidance on when you should report a fever and what temperature they would like you to report at. Keep all your appointments as scheduled, and you need to have a working thermometer to be able to monitor your temperature at home. And you want to record and track your blood counts, including the white blood cell and absolute neutrophil count, and record your symptoms, including fevers, shaking chills, or just chills, or any signs or symptoms of an infection. And at all times, it's a good idea to wash your hands frequently. So these are additional recommendations for things you can do if you're neutropenic. You want to avoid people who are obviously ill. That includes people who are coughing or have a runny nose. You want to avoid crowded and enclosed places. This doesn't mean you can't go out. You just want to go out to places when they're not so crowded. And you want to avoid buffets and crowded shopping areas or concerts. When you're having problems with your neutrophil count, you also want to avoid uncooked or unpasteurized meat or dairy products, and be sure to wash all fruits and vegetables before you eat them. Maintaining good hygiene is also very important, with daily bathing, good oral hygiene, and cleaning after bowel movements or urinations. And as usual, wash your hands frequently. And you want to stay well hydrated, and again, ask for help from your family and friends. So what can you do if you're thrombocytopenic and you have myelodysplastic syndrome? Remember, thrombocytopenia is when your platelet count is low, and the primary concern for patients with thrombocytopenia is bleeding. The risk of bleeding is related to how severe your thrombocytopenia is. A normal platelet count is normally between 150,000 and 450,000 per microliter. Mild thrombocytopenia is when the platelet count is 50 to 100,000. Moderate thrombocytopenia is when the platelet count is between 25,000 and 50,000. And severe thrombocytopenia is when your platelet count is less than 25,000. Symptoms of thrombocytopenia are related to bleeding. Excessive bruising or bleeding can be seen, especially of the gums and nose area. You can also have cuts that won't stop bleeding. Petechiae, these look like little red freckles on your skin that you didn't previously have, coughing up blood, or blood in the urine or stool. These are things that your doctor may recommend. Sometimes we recommend platelet transfusions, especially when the platelet count is below 10,000, or even at higher levels for patients who have additional risk factors such as a recent surgery. Platelet transfusions are considered a form of supportive care. The benefits of platelet transfusions, like with packed red blood cell transfusions, are temporary and only last for a short amount of time. So you may need repeated transfusions throughout the disease process. Platelets tend to last only for hours, while packed red blood cells may last for several days or weeks even. Your doctor will recommend that you stop taking any medications that interfere with platelet function. Many of these are over-the-counter, so it's better to ask before you start taking a new over-the-counter medication. Things like aspirin, which prevent clotting, and other blood thinners such as Coumadin, Plavix, and heparin. These medications are generally held when the platelet count is below 50,000. These are things you can do if you have thrombocytopenia or a low platelet count. Let your doctor know if you experience any unusual bruising, uncontrolled bleeding, or develop petechiae. Remember, those are the little red dots that look kind of like freckles. And you want to keep all your appointments as scheduled and record and track your blood counts, your transfusion dates, and any symptoms before and after transfusions. You want to avoid excess alcohol, which can contribute to platelet dysfunction, and avoid injuries such as falls, cuts, and scrapes, and activities that can cause bruising or bleeding, such as contact sports or heavy lifting. Another thing to consider is constipation or straining to have a bowel movement. You may need to use a stool softener so that you don't experience bleeding associated with bowel movements. And use a soft toothbrush when brushing your teeth. And again, ask for help from your family and friends. These are things you can do if you have thrombocytopenia. Let your doctor know if you experience any unusual bruising, uncontrolled bleeding, or develop petechiae. Keep your appointments as scheduled. Record and track your blood counts, transfusion dates, and any symptoms before and after transfusions. Avoid excess alcohol, which may contribute to platelet dysfunction. Avoid injuries, and avoid constipation. So managing cytopenias. Cytopenias, again, are lowering of your blood counts, which is common in patients with myelodysplastic syndrome. You can reduce the severity of side effects from the cytopenias by talking with your healthcare team about your blood counts and monitoring your blood counts. Explore further the building blocks of hope for additional information. Thank you.